Well, everybody says there's going to be an epidemic of arthritis coming. And that's because there's 80 million baby boomers come along. They all have 72 joints, and every one of them can have arthritis, right? And so what's the problem here? Why would 80 million baby boomers get arthritis? Well, because they listen to medical doctors. They exercise, put a lot of wear and tear energy onto those joints. They told them, don't take any vitamins and minerals. You could overdose, so there's no raw materials to kind of maintain and repair. And then, of course, they say drink plenty of water. Well, you drink water. Sweat is more than water. Sweat is a soup that contains all the known essential nutrients, 90 essential nutrients, unless you're only taking in 65, and then it's worse, right? Or you're not salting your food so you can't make stomach acid, and it's not really how much you eat or what you eat, it's what you absorb. And so we have all these sort of ifs, sort of conditions that have to be met here before you get optimal amounts of nutrients in your food, you get optimal amounts of nutrients absorbed, and you get optimal amounts of nutrients deposited in the bones. Well, before we go on and tell you how we're going to do this, about July of 2002, in the New England Journal of Medicine, Harvard Medical School did a meta-study. They looked at over 300,000 people who'd gotten joint replacements from all over the world, and they said knee replacement, hip replacement, shoulder replacement, unnecessary, worthless, okay? And that's because it doesn't stop the ongoing deterioration of the bone, doesn't stop the ongoing deterioration of the joints in all the other places, right? It just takes the one joint or the two joints that they're replacing, throw them in the garbage can, and so you can't feel anything anymore, but it doesn't stop the ongoing progress of the problem, the systemic problem. And then 4 years later, the same group of doctors from Harvard Medical School looked at the backs of these people, and they said, oh, surgery for sciatica is worthless and dangerous. Don't do it. They're talking about low back pain, degenerative disc disease, restless leg syndrome, peripheral neuropathies, burning numbness in the feet, and as a result, they say don't get surgery for these problems. So what I always say is give me 90 days. Give Doc 90 days, and you are going to see one of those miracles. And basically, what's going to happen here is we are going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And to do that, you need all 90 essential nutrients. There's 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And, of course, you might need some anti-inflammatory stuff, which we can do with herbs and aromatherapy oils. And certainly you might need some extra stuff if you have bone-to-bone arthritis to, again, support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. You actually have to lay down new bone matrix. It's kind of like the rebar of the bone. It's a tendon-like material before you can lay down new minerals. And, of course, you just can't take calcium. That's not enough. You need more cofactors to make it all work. Your bones are made up of all 90 essential nutrients. So I urge you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. So what you do to do that is you take one healthy bone and joint pack per 100 pounds of body weight. That's going to give you one jar of the CM cream to apply topically to joints for pain relief, great analgesic cream, topical use. And it's going to give you one large 240-count bottle of glucogel and one healthy start pack. So if you weigh 150 pounds to 210 pounds, I would take 2 of the healthy bone and joint packs per month. If you weigh 50, 60 pounds, I'd have you take one healthy bone and joint pack. If you're in a Pee Wee League, kid sort of thing, and you have a knee problem, shoulder problem, back problem, go ahead and take one healthy bone and joint pack, but that's going to last 2 months. For a 100-pound person, it's going to last 1 month. For a 200-pound person, give or take a few pounds, it's going to last 2 weeks. It goes by body weight. And you're going to get 245 nutrients in this package, including all 90 essential nutrients, plus the extra glucogel to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Give Doc 90 days. Let me tell you, this never fails. If you're not getting it even at the speed you wanted to, guess what happens here? This means you got to get on a gluten-free diet so you can maximize your absorption. You are not what you eat. You are what you absorb. And then, of course, there's also another possibility. No reason why you couldn't have both problems. As you've been restricting salt in your diet, you're not making stomach acid. It's very difficult to absorb minerals without stomach acid. Very difficult to efficiently absorb B12 because the intrinsic factor won't work without stomach acid, and it's almost impossible to digest proteins without stomach acid. Your pepsin won't work, and as a result, you're going to be in a real struggle. And so you have to deal with that. Salt your food to taste. You make sure that you're going ahead and allowing the chief cells in your stomach to make your stomach acid. And then, of course, you want to get on a gluten-free diet, and you will actually allow your villi, those little finger-like projection, to rebuild, regrow, and you want to regain some of that lost absorptive surface. And, of course, this happens progressively, slowly, but surely over time if you're gluten intolerant. Get a hold of that CD, Serial Killers, and learn how it affects you and all the places that gluten is hidden. Give Doc 90 days, and you will be happy, and you won't get knee surgery, hip surgery, back surgery, shoulder surgery. What are orthopedic surgeons to do? We really care. Back after these